Thomas, District H and District F. And then also Chief Asaleda, Chief Pena, and Dr. David Purse today. Let me, as you can tell, as you can see, I'm wearing this mask today. The focus is on the census. And the reason I bring it up is that with all of the federal dollars, resources that we need to combat the pandemic, quite frankly, it's all tied to the census. And right now, we're at about 52.5, 53% in response. The average response in the country is a little over 60%. And we're at 52, 53%. And so I want to encourage people to take the time to respond to the census, 2020census.gov. Online, 9 questions, doesn't take very long at all. You can call. I don't have that number with me at this point, but I will have it. So just want to say, today we will notice that, this Census 2020 mask, and next to keeping everyone updated to COVID-19, I just want to remind Houstonians of the importance of filling out your census form. And as of July the 5th, 52.5% of Houston's estimated 2.32 million residents have completed the survey, according to the most recent census data in Harris County. It's 9 questions. It takes only a few minutes. And for each person who goes unaccounted for the next 10 years. So even a 1% undercount could cost the city of Houston $250 million in federal dollars for every 1% that we fail to count. And we need that money for education, housing, health care, and representation. So the census is critically important, especially when we are trying to fight COVID-19 and other pandemics that may come down the pipe. Today, the Houston Health Department reports 412 new cases of COVID-19, bringing Houston's total to 26,012. Unfortunately, the number of deaths in our city will increase by 5, bringing it to 250. And the 5 newly reported deaths happen to be a Hispanic male in his 30s with underlying health conditions who passed away on June 29th. A black female in her 50s with underlying health conditions, May 24th. A Hispanic female in her 50s, again underlying health conditions, June the 6th. A Hispanic male in his 50s, underlying health conditions, June the 21st. And a Hispanic male in his 70s, underlying health conditions, June 19th. So again, the numbers are moving in the wrong direction. Quite frankly, the state is out of control. And what we do today and over the next few weeks is critical to getting this virus back in a manageable state. And the goal for us is to bring the number of cases that we report on a daily basis. The goal is to bring that number down below 300. And I say 300, that's the number I'm using, because it makes it then much more practical for us to engage with our contact tracing, okay? So we need all these components to be working together. And so the goal for us is to bring that number that we report every day down to under 300 over a 7-day period. Okay, not just 1 or 2 days. And allowing our hospitals what they need to be able to handle any particular person in the city of Houston. The capacity is at 650 at each site. Each capacity, quite frankly, still around 12. Again, we are now in phase 2 with regards to the Texas Medical Center. The next 13 to 14 days will be very, very important. And that's why it is highly important for us all to do our part to flatten the curve, to engage in social separation, to wear these masks. Work remotely, especially if you are sick, please stay home, or if you have underlying health conditions, please stay home. Wear a mask. Remember that many people who have the virus never show any symptoms, and that is why it's important that everyone wear a mask, so mask up. I want to talk about a new testing, and let me just bring up first, let me bring up Councilmember Carter's